very few people use it. A study we did some years ago now showed that fewer than 2% of physicians and surgeons and technicians that do a lot of diabetic foot specialty work actually use that device as their primary means of offloading. So this gold standard, unfortunately, is not so golden. So what can we do? There are technologies that can offload the foot as well as a total contact cast in the laboratory. But then if they take the device off, then it's not going to work. So what if you could render that thing irremovable? And that is where our technologies can intersect. And that's where we've led to what we used to call the instant total contact cast, where you could take devices like this and render them irremovable. And now what's great there are technologies that are emerging that actually have this idea of irremovability and the option for irremovability built in. This technology is really the sum total of a lot of effort that has gone into offloading the foot over an entire generation. You have options for irremovability. You have the ability to change out the insole and this technology to improve offloading and customize it. Yes. And you have something that offloads actually as well as a total contact cast, yes, all in one device. And the thing is easy to modify, easy to maintain, and it's a little bit like it's like an Inspector Gadget of technologies where you can just mix and match. It's pretty great. It does. I think it gives one the option for just being modular, and that's what's terrific. And so, it's almost like, clip this on, clip this off, and you have yourself a kind of mass customization. So this technology allows for one to modify one's therapy based on where that patient is in any given time. So it's quite flexible, and so if the anatomy changes, as it does sometimes in Charcot, one can change subtly the amount of offloading in an area as one sees progress, as one sees the patient and their swelling reduce, or the signs of a wound healing, or even the signs of another wound developing. This kind of thing is difficult to do in other kinds of technologies because you can't really snap on, snap off like you can here.